Please start.
Hello, good afternoon. I'm Dr. Kajol, one of the doctor in this clinic. May I confirm your name and age, please?
Yes, sure, doctor. My name is Smith, and I'm 24 years old.
Okay, Mr. Sumit, how can I help you today?
Doctor, I'm having these bad headaches, and specifically on the left side of my head. And I'm really unable to concentrate on my daily activities because of these headaches. So, I'm also having some nausea along with these headaches. And I also took paracetamol, but it was not effective at all. So, can you please tell me? Because I think it might be some tumor.
Oh, I'm sorry to hear about that, Mr. Sumit. I can understand how stressful this must be for you, but uh, uh, I would like to ask a few further questions regarding this condition, if you don't mind.
Yeah, sure, doctor.
Okay, Mr. Sumit, can you exactly tell me where your headache is?
It's in the left side, doctor, on the temple area specifically.
Anything, Mr. Sumit, anything particular or anything that makes your headache more worse?
Yes, doctor, I've noticed that when I drink red wine, the headache is quite, you know, intense, and the pain increases at that particular time.
Okay, Mr. Sumit. So, based on your symptoms, I don't think you have a tumor. That is a very big condition. So, you don't need to worry about that, Mr. Sumit. And based on your symptoms, I think you need a neurological examination. And let me explain that why it is necessary for you. Would you like me to explain you, Mr. Sumit?
Yes, doctor.
So we will perform a neurological examination, mainly to check the signs of neurological, any particular neurological disease. So that's why it's important for you, Mr. Sumit. Am I clear to you?
Yes, doctor.
Uh, uh, Based on your okay, Mr. Simit, based on your examination and symptoms, I believe that you are having a condition called migraine, and I don't think you need to get worry about this because this will go on by time and with a proper advice. Am I clear to you, Mr. Simit?
Yes, doctor. But I'm very much concerned because my mother died 10 years ago, and she was having the similar headaches. And at that time, she was taking barbiturates, if I'm not wrong, and they were quite helpful. Would you please prescribe me the same medication so that I can feel better?
Sorry to hear about your mother's condition, Mr. Simit. I can feel your pain, but let me tell you that there are many treatment options available. Would you like me to explain them for you?
Yes, doctor.
So, the condition you are having is migraine. So, there is preventive as well abortive treatment options available that will help you for sure. And I don't think you will need barbiturates because these medications are habit forming, and we don't mostly use these medications nowadays. So I don't think that these will relieve your pain, Mr. Smith. Uh, do you understand this?
Yes, doctor, I understand that.
Pleased to hear this, Mr. Simit. So here is my card. You can take it, and whenever you need to contact me, you can please. Thank you.
Okay, Dr. Kajal, I think this was good. Uh, Most of the boxes are ticked. You can definitely improve, and there is always room for improvement. Okay, but overall, if I say this was a very good presentation, we need a bit more practice so that we can get done with it. And I'll be explaining the whole card one again to you guys. So whatever the things you will be lacking, you will eventually get that. Okay. So let me just give me a minute, and I'll explain you guys the whole card in detail, every task, how to perform that.